Saliva, that often overlooked liquid in our mouths, is far more complex than it appears. It's essential for the initial stages of digestion, breaking down food with enzymes like amylase, which starts the process of converting starches into sugars. Beyond digestion, saliva plays a crucial role in maintaining oral health. It acts as a natural cleanser, washing away food particles and neutralizing acids produced by bacteria. It also contains vital antibodies and antimicrobial substances, like lysozyme, that help combat harmful microorganisms and protect our teeth and gums from infection. However, saliva isn't just a protective shield. It's also a bustling ecosystem teeming with a diverse range of microorganisms. This oral microbiome includes bacteria, viruses, and even fungi. While many of these microorganisms are harmless or even beneficial, helping with digestion and maintaining a balanced oral environment, some can be detrimental to our health. Harmful bacteria, for instance, can contribute to tooth decay, gum disease, and other oral infections. The presence of these microorganisms raises an interesting question. Can we, or should we, disinfect saliva? While saliva aids in keeping the mouth clean, the microbial content suggests that some level of disinfection could be beneficial. Exploring the possibility of disinfecting saliva methods and limitations. While the idea of completely eliminating microorganisms from saliva might seem appealing, it's neither feasible nor desirable, particularly within the oral cavity. Saliva's beneficial components, like enzymes and antibodies, are essential for digestion and oral health. Eliminating them would disrupt these crucial processes. However, when dealing with external saliva samples, for example, in a laboratory setting, disinfection is possible. Methods like autoclaving, which uses high pressure and steam, can effectively kill microorganisms. Chemical disinfectants, such as bleach or alcohol-based solutions, can also be used. Another option is UV irradiation, which damages the DNA of microorganisms, rendering them harmless. It's important to understand that these methods are strictly for external use and are not suitable for disinfecting saliva within the mouth. The harsh chemicals and extreme temperatures would be harmful to oral tissues. Even when disinfecting external saliva samples, it's challenging to eliminate all microorganisms completely without affecting the other properties of the saliva. Disinfectants can sometimes alter the composition of saliva, potentially interfering with its intended use in research or diagnostic testing. Therefore, while external saliva disinfection is possible, it comes with limitations and considerations. Maintaining oral hygiene. A practical approach to managing saliva's microbial load instead of focusing on unrealistic and potentially harmful attempts to disinfect saliva within the mouth. A more practical and effective approach is to concentrate on maintaining excellent oral hygiene. This involves a consistent routine of brushing your teeth at least twice a day, ideally after meals, using fluoride toothpaste to strengthen enamel and combat decay. Flossing daily is equally important, as it removes plaque and food particles from between teeth and along the gum line, areas that brushing alone can't reach. Additionally, using an antimicrobial mouthwash can further reduce the number of harmful microorganisms in the mouth, helping to prevent gingivitis and other oral infections. A balanced diet, low in sugary foods and drinks, also plays a vital role in maintaining a healthy oral microbiome. Sugary substances feed harmful bacteria, leading to acid production that erodes tooth enamel. Regular visits to the dentist are crucial for professional cleaning, early detection of any oral health issues, and personalized advice on maintaining optimal oral hygiene. By prioritizing these practices, we can effectively manage the microbial load in our saliva and promote a healthy mouth without resorting to harsh or unnecessary disinfection methods. The concept of disinfecting saliva presents a unique challenge. While achieving complete sterilization within the mouth is not only impossible but also detrimental, certain methods can be employed to disinfect saliva samples outside the oral environment. These include autoclaving, which utilizes high-pressure steam to kill microorganisms, chemical disinfectants like bleach, known for their broad-spectrum antimicrobial activity, and UV irradiation, which disrupts the DNA of microorganisms, rendering them inactive. However, it's crucial to understand that these techniques are specifically designed for external use and are entirely inappropriate for application inside the mouth. Introducing such harsh methods into the oral cavity would disrupt the delicate balance of the oral microbiome and could damage sensitive tissues. Moreover, even with external disinfection techniques, achieving complete elimination of all microorganisms proves difficult. Some resilient microbes may survive, and the process itself can alter the inherent properties of saliva, potentially affecting its enzymatic activity and other beneficial characteristics. Therefore, directly disinfecting saliva isn't a viable solution for improving oral health. The focus must shift to safer and more practical strategies that maintain a healthy balance within the oral environment. Given the complex nature of saliva and the limitations of disinfection, the most effective strategy is to prioritize maintaining good oral hygiene. Rather than trying to eliminate all microorganisms, which is both impractical and potentially harmful, we can focus on controlling the balance of bacteria in our mouths. This starts with a consistent and thorough oral hygiene routine. Brushing your teeth at least twice a day, using fluoride toothpaste, is fundamental for removing food particles and plaque, the sticky film where bacteria thrive. Flossing daily is equally important, as it reaches areas your toothbrush can't, like between your teeth and under the gum line. Removing plaque from these areas helps prevent gum disease and tooth decay. The use of antimicrobial mouthwashes can further reduce the bacterial load in your mouth, especially after brushing and flossing. However, it is important to choose mouthwashes carefully and use them as directed, as some can have side effects like staining teeth or altering your taste perception. Beyond brushing, flossing, and mouthwash, your diet plays a significant role in oral health. Limiting sugary foods and drinks is crucial, as sugar fuels the growth of harmful bacteria that produce acids that erode tooth enamel. A balanced diet rich in fruits, vegetables, and whole grains supports a healthy oral microbiome and overall well-being. Regular dental check-ups are also essential. A dentist can provide professional cleanings to remove hardened plaque or tartar and detect early signs of tooth decay, gum disease, or other oral health problems. Early detection and treatment can prevent more serious issues and help you maintain a healthy smile for life.